Hello, I'm Marleen Kets. I'm a clinical geneticist at Radboud University Medical Center in Nijmegen, the Netherlands.
My name is Karen Heath. I'm a clinical molecular geneticist based in Hospital Paz in Madrid, and I am a member of the ERN BOND.
Hello, my name is Sergio Sousa. I'm a medical geneticist from Pediatric Hospital of Coimbra, and I'm a member of ERN BOND.
Hello, my name is Georgina Hoffmann. I'm a patient representative with the ERN GENTURIS, living in Germany, and I'm originally from Canada.
What is a genetic test?
A genetic test analyzes a person's DNA to identify harmful variants in the DNA. In the clinic, we call these pathogenic variants. Pathogenic variants can cause a disease or can predict the risk of developing a disease or can guide treatment options and decision. In this video, I will discuss pathogenic variants that are present in all body cells and not the acquired pathogenic variants that can occur later in life.
What types of genetic tests can be done and for which purposes?
There are several types of genetic tests that can be performed, and these include molecular tests, which search for a variant or a mutation in a gene or a collection of genes. And they often involve next-generation sequencing, an exome, a genome, or a panel of genes. And they enable testing of multiple genes at the same time, so increasing the likelihood of identifying the cause of the genetic disorder. The second type of tests are the cytogenetic or chromosomal tests, and these look for larger changes, missing, extra or rearrangements in chromosomes which package the DNA. And these tests may include karyotype or arrays. And then the third type of tests are biochemical tests, and these measure proteins and enzymes to detect abnormal activity caused by genetic conditions. And these, in combination with molecular tests, will be able to be used to identify the genetic disorder.
What kind of information can you expect to learn from a genetic test?
A genetic test can reveal different kinds of information depending on the type of test and the reason it's being done. For instance, in the context of health and medical information, it can help to reach a diagnosis, whether you have or not a genetic condition, for instance, a skeletal dysplasia. Can help determine a risk or a predisposition, whether you have a higher chance of developing certain diseases. Can help determine what we call the carrier status, whether you can pass a genetic condition to your children even if you don't show any symptoms. It can also help with treatment guidance, which medications might work best for you. Pharmacogenomics is what the name we usually use for this setting, or whether certain therapies are likely to be effective. In the context of reproductive and family information, it can also help to determine or to answer the questions whether your child may inherit a genetic disorder or whether you and your partner carry the same genetic condition. This will be important for the family planning. However, the key thing to know is that not all genetic tests give clear answers. Sometimes the result is uncertain, or it only shows a possibility and rather than a certainty.
What impact can genetic test results have on personal and medical decisions? Can you share an example?
A genetic test result can influence treatment of the disease and can guide preventive measures like screening or prophylactic treatments. A genetic test result may influence personal decisions like adopting a healthier lifestyle. It can, for instance, influence reproductive decisions, guiding family planning. An example is a woman who carries a pathogenic variant in the BRCA1 gene. She has a high risk of developing breast and ovarian cancer. She has the option to follow intensive breast screening from the age of 25, or she can opt for preventive breast surgery. In addition, preventive measures are advised due to her increased risk of ovarian cancer. Her decisions are guided by a team of professionals who provide comprehensive information and will discuss the pros and cons of the various options she has. While taking her personal preferences into account, a personalized risk management plan will be made.
What happens if the results of a genetic test are uncertain or inconclusive?
In case a genetic test result is uncertain, A variant of unknown significance is found in the DNA. This means that it's unclear whether the variant is pathogenic or benign, which means unharmful. Sometimes additional tests are proposed to gain more clarity about the consequences of the variant. Additional testing may include an extra test in the patient or testing of more affected relatives for the presence of the variant. If the significance of the variant remains unknown, the cause of the disease is unclear and the treatment remains the same as before the genetic test. The genetic counselor will provide advice on when to inquire for new information because sometimes knowledge on a particular variant in a gene increases over time.
How are genetic tests performed?
Firstly, a genetic counsellor or medical geneticist will provide genetic counselling to explain to you about the genetic tests, explaining what the aims of the test are, the risks and the benefits. The individual or the parents for the children will then need to sign a consent form so that the genetic test can be performed. A sample will be taken, and in the majority of cases, it will be a small blood sample from the individual and sometimes other family members, such as the parents. The sample will then be sent to the genetics laboratory to perform the genetic test, but the results can vary in time due to the complexity and the urgency. The medical geneticist or genetic counsellor will receive the results and then provide post-test genetic counselling, explaining the results and their implications in medical care and family decisions. In summary, genetic results can guide medical care, shape life planning and affect emotional well-being, but it must be remembered that not all variants mutations may be identified by genetic testing. Our knowledge is increasing every day, so although the cause of the disorder may not be identified today, it may be in the near future. And together, the ERNs have a knowledge and experience with the aim to help diagnose, monitor and treat these individuals. So working with the ERNs will helpfully help diagnose these cases in the future.
Why did you decide to undergo genetic testing, and what concerns did you have beforehand?
I underwent genetic testing 1 month prior to my 30th birthday. My mother, my aunts, and my grandmother all developed cancers in their late 30s and early 40s. I was concerned that I too had inherited the mismatch repair gene that my mother and all of my relatives inherited. They had the MSH2 gene variant. My mother encouraged me, after a heartfelt conversation, to consider the future of my children and myself, and encouraged me to go for genetic testing.
How were the results of your genetic test explained to you? And were there any challenges in understanding the implications of your test results?
The genetic counselor explained the results of being positive and told me that a positive test result for Lynch syndrome isn't necessarily a positive result for cancer. She explained to me that everyone has a chance of developing cancer in their lifetime, and that when someone has a Lynch syndrome positive gene variant, the chances are increased. And she also told me that my children had a 50% chance of also inheriting the Lynch syndrome gene mutation.
Did the genetic test result lead to changes in medical care or decision-making?
The genetic test result confronted me with the fact that an intensive screening would become part of my regular regime with gastroenterologists, including colonoscopies, skin screenings, and multiple others, as Lynch syndrome is very all-encompassing gynecological cancers as well.
Looking back, how do you feel about your decision to pursue genetic testing?
Looking back, I realized that I was in denial of my genetic predisposition for developing cancer. I was reluctant to speak about the results due to the fear that was buried deep inside of me from witnessing the painful surgeries of my mom and other relatives. Thankfully, my mother and my aunts were all very caring and supportive. Through sharing their experiences and advice with me, I felt emotionally supported.
Would recommend genetic tests to someone else?
The decision to pursue genetic testing is an important decision which has been life-saving for me, and I am very grateful to my courageous mother who introduced me to genetic testing and who also encouraged and supported me through this process. 1 year after my own ovarian cancer diagnosis, my 2 adult sons decided to also pursue genetic testing, and thankfully they both tested negative for the Lynch syndrome gene variant. So sometimes a negative diagnosis can be extremely positive. I'm very grateful that they're able to carry on and not worry about Lynch syndrome. And as we say in Genturis, with every diagnosis, we can help an entire family.